Hi, so I'm here in my Westminster office. Of course, yesterday there was a lot of talk about local restrictions, so I want to give you a bit of an update on that. So what you will have seen is a message out from the County Council and from District Council and so on, talking about different restrictions in Nottinghamshire. Now, as it stands, the government hasn't actually imposed any restrictions on us at all, so this is more guidance. So what we do know is that the rates in Nottingham have been very, very high. The areas that are surrounding Nottingham are also going up quite considerably. So if you imagine cases per 100,000 or so, Nottingham is about 400 and something. England, the average is about about 100 odd, 120 odd, something like that. So Nottingham is very high, and we know that obviously something needs to be done about it, and it's absolutely right that those measures are reviewed. So there'll be some sort of decision on that that's coming up. What I would say, though, is if you look at other areas of Nottinghamshire, some of us have significantly lower rates. So whilst you've probably got a lot of the constituencies and the districts that surround Nottingham whose rates are going up, you can look at, say, our rate in Bassetlaw. We're only about 80 odd per 100,000, and Mansfield next door, theirs is only about 60. So we do have the second lowest rate in the county at the moment. Now, when you get to about 80-ish cases, then that's basically where the government say that's what they call a level of concern, where they'll look at things. However, our rate is, as it stands, nowhere near the other areas. So what I've said is basically that we need to consider, before we actually do put any local restrictions in, which have been seen elsewhere, that we should consider this. Now, of course, we're quite a long way from Nottingham in Bassetlaw, and my argument is that this, compared with our low rate, we've had fairly low rates in the hospitals. I think that's absolute testament to the people of Bassetlaw who've been working so hard to follow those rules, whether it's washing the hands, wearing masks with social distancing, and a great staff at the hospital who've really done us proud. Now, what we do know is that the rates have been going up, even in Bassetlaw where our rates are low. So as things stand at the moment, for North Nottinghamshire, I'd like to know any measures for the entire county. I would want them to be looked at on a bit more of an individual basis, and whether we actually need to do that or not. So we're going to have some meetings on this. I've got a meeting today to discuss it. Obviously, it came out yesterday. That's not something I was involved in. So obviously, I found out I'm not too keen on having Bassetlaw included unless the data absolutely suggests it is. So there may come a point where Bassetlaw's data goes up and we need to have these extra restrictions. It's also important to say a lot of people talk about local lockdowns. These are not lockdowns. So it's not like, for example, what we had in March, April time, where things were very different. It does mean some extra measures. For example, households mixing. We're looking at a lot of the infections seem to be coming from that. So this is something that could be going on, but I'm speaking to ministers, I'm speaking to colleagues about it. I've got meetings locally too. So as your member of parliament, obviously I'm going to fight for Bassetlaw, and any restrictions that we do have got to be fully justified, and that's what I'm going to be talking about today. So I'm going to be keeping you updated through everything, and in the meantime, thank you so much for all your efforts, and stay safe.